Hi, I'm Steve Adubato. Thank you so much for watching us. This is part of a series that we're doing trying to make sense of not just COVID overall, but the vaccine, where we are with it, the questions you need to have answered. And we're honored to be joined by Dr. Shereef Elnahal, President and CEO, University Hospital, also the former Commissioner of Health in the great state of New Jersey. He's joined by his colleague, Dr. Chris Pernell, Chief Strategic Integration and Health Equity Officer, at University Hospital. Thank you so much for joining us.
Thank you, Steve.
Good to be here.
Dr. Elnahal, let me ask you, we're taping on the 13th of January. We'll put up the CDC website, the New Jersey COVID website. A lot is going to be changing. Things are changing as we speak in terms of categories and who's eligible, who's not. Let me ask you this. Biggest lessons you've learned, because I believe the first vaccine was administered at university, correct?
It was. The first person vaccinated outside of a clinical trial for COVID-19 was at University Hospital. Maritza Beniquez, one of our nurse heroes in the emergency room, also a proud Latina American, who delivered her message of support for vaccination, not only in English, but also in Spanish. Hispanic Americans have been, unfortunately, the #1 demographic we've been seeing with admissions and hospitalizations here at University Hospital. Was really an amazing moment.
Dr. Pernell, let me ask you, I've seen you so many times, and by the way, if you want to check out what's going on every day as it relates to COVID, the vaccine, et cetera, check out NJ Spotlight News, check out Metro Focus. Both of our colleagues at University have been on many times. Dr. Pernell, let me ask you this. The distrust, the questioning, if you will, particularly in communities of color, say this program is seen a month or 2 months from now, where do you believe that will be as it relates to the vaccine?
I think we're moving, Steve. I actually truly believe we're making some progress. I'm not saying we're making quick progress, but we're making meaningful progress. And that's been able to be achieved by demonstrating trustworthiness. And how we do that is by showing up and giving people space to process their feelings, whether that's concern, whether that's fear, whether that's skepticism based in historical injustices and systemic racism, being able to speak to those issues head on, not hiding from them, not ignoring it, and being able to meet misinformation with science and facts. I think that matters for folks, and people are on a decision journey, and the more we can do to help them be informed, the better.
Dr. Elnahal, I'll jump in on that question, because it is not just what does the supply look like, what does the distribution look like, it is what is the trust level like. Share your thoughts on that, Dr. Elnahal.
I would completely agree. So I know that Dr. Pernell and I have both been on the floors of our hospital having these conversations with our own employees. And it's really telling that you have educated people who know the science, who know medicine, but who also come with the lived experience of being people of color right here in our hospital. And convincing them will be very important, because they are the trusted stewards of this to our majority minority community that we serve here in Newark. So yes, demonstrating trustworthiness and convincing folks right here in our own hospital who can then be ambassadors to our community.
You know, it's so interesting. You know, the nurse, Maria Beniquez, it was very public what happened. And she had a public message both in English and in Spanish. So I'm curious about this. As it relates to our series on vaccine awareness, and everyone in the media trying to do the best we can on this, how important, Dr. Pernell, do you believe it is for people to take the vaccine publicly who are either recognizable figures or whose jobs are very prestigious, like a nurse? How influential and important is that, including yourselves?
Mm-hmm. So, as you know, I participated in the COVID-19 vaccine trial, and I was unblinded recently, and I learned that I was in the investigational vaccine arm. So I have been vaccinated since the very beginning of October. And the ability to share that message publicly, right? If we could center on the public narrative, yes, photos are a part of that, but that larger public narrative, if people who are trusted in community, people who have social capital, if you will, social and cultural fluency with the communities that are the communities we want to make progress with, allowing them to hear our stories as we hear their questions are just as important as taking those public photos. So I think it's a meeting of those two opportunities.
Dr. Elnahal, athletes, business leaders, healthcare leaders, governmental figures that are respected. By the way, the fact that presidents are several past presidents, Democrats, Republicans, public, that matters, Dr. Elnahal, please.
It definitely matters. And as Dr. Pernell mentioned, it's only one of many things we can do to get folks convinced on this. We have to take the words and the actions of national respected leaders and combine that with people who are local, who are trusted as well, leaders of civic organizations, faith-based leaders, and folks who really have the trust of communities on the ground. I think if you combine those efforts, that's the best way we can get more and more buy-in into this vaccine.
Question, it's interesting as it relates to race. We've been also doing a series called Confronting Racism. Dr. Pernell, you've been outspoken, national media, you and Dr. Elnahal on this. To what degree, say this is seen a year into the COVID crisis and beyond, what has this COVID crisis revealed about structural and institutional racism in our society?
We can't deny it. We can't ignore it. And it's no longer a theoretical or academic topic. It is a topic that average, everyday Americans are being confronted with because the glaring disparities are just unavoidable. The disproportionate burden that Black and Brown communities have experienced through this pandemic, whether it's mortality, whether it's morbidity, meaning lingering systems, whether it's the economic fallout. I don't think any of us can turn away from that. So what I'm really hopeful for is that energy, right, that focus will really lead to intentional action, like Dr. Elnahal and I have been talking about. Demonstrating trust and worthiness is one part of it, but seeing how anchor institutions like hospitals, like University Hospital, can really begin to work upstream and look at those structural determinants that can interrupt that vicious cycle of structural and institutional racism.
Along those lines, Dr. Elnahal, you are playing a role in the Biden administration as an advisor. Tell everyone exactly what it is. I don't want to get that wrong. What role are you playing?
I'm on the transition team, honored to be helping transition the Department of Veterans Affairs, where I used to work before I was health commissioner in New Jersey. And I can tell you that the transition team and the incoming team focused on COVID-19 in the administration will be very focused on health equity. There's already a COVID-19 health equity task force that is currently being formed. Dr. Marcella Nunez-Smith, a very esteemed researcher in health equity, is going to be chairing that. And it's going to be front and center. It's not just going to be a silo of work. It's going to pervade every aspect of the administration's work on this pandemic, which is so important because, as Dr. Pernell mentioned, we cannot sideline this issue anymore. It will never be more clear that the health and well-being of a Black or brown person, whatever community it is, has a direct bearing on your health, no matter where you live, given that we have to vaccinate 70 to 80% of the population to make progress. So it's very promising.
I'm sorry for interrupting. I'm going to follow up on this. People who say government's too involved in our lives, we need less government. I understand, I understand it philosophically, I get it. But we cannot deal with a crisis like COVID-19 without a strong governmental system on the federal, state, local level. Dr. Elnahal and then Dr. Pernell, how important is it that the Biden administration, state government, local county government, that they're all involved in this? It's not just more government, but government very involved in this. Please, Dr. Elnahal first.
Well, my simple argument on that, Steve, is that this is why government exists. There's a spectrum of preparedness, of infrastructure, of readiness to be able to meet this pandemic. And to simply hand off a vaccine to states and say, figure it out, has not worked. And that's been the posture, unfortunately, of the administration currently in place, soon to be changed.
Again, we're taping on the 13th. The administration will be different when this is seen. I'm sorry, Dr. Elnahal, pick up your point.
No, absolutely. And so now that we have an administration that has come in that is committed to filling in the gaps where possible, I'm very optimistic that we'll finally be able to make progress for communities of color and beyond to get us out of this pandemic.
Thank you. Dr. Pernell, the role of government in all this.
We need smart government, right? If we centered this conversation on health itself being a public good, we need smart government, and smart government is effective and efficient involvement at every level. The fact that we have vaccines, we have 2 mRNA vaccines that have gone through the emergency use authorization is an example of how when government infuses itself into the process to remove barriers, whether those are financial barriers or otherwise, it matters and it's important pour into the health and well-being of the population as a whole. So I hope that we can use this as a launching pad to say, where can government be smartly involved to impact the lives of its citizens?
By the way, as we speak, there are two, but Johnson & Johnson, we don't know. We're not going to try to predict. That's irresponsible. There may be a third, Dr. Pernell. Is that fair to say? Say March 1st, April 1st. That's possible?
Well, we have several candidates that are in late phase clinical trials. Johnson & Johnson is one of them. I do think around the spring, we probably will see another candidate come before the FDA, but we can't say certainly what date that is. But I'd say stay tuned. And it's just a good sign that the science is working. It's a good sign that science and data are doing what we need it to do. And we can trust that process to deliver, because it has delivered so far.
Well said. By the way, again, check out the CDC website, which has been up throughout this segment, the covid19.nj.gov/vaccine. Dr. Elnahal, Dr. Pernell, thank you so much for being with us and shedding important light on this topic. We'll keep in touch. Thanks so much. Stay safe and be well, and thank you for everything you're doing.
Thanks, Steve.
Thanks, Steve.
I'm Steve Adubato. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, the New Jersey Economic Development Authority, the Healthcare Foundation of New Jersey, PSC&G, New Jersey Sharing Network, NJM Insurance Group, the Robert Wood Johnson Foundation, Investors Bank, and by Rowan University. Promotional support provided by NorthJersey.com and Local IQ, part of the USA Today network, and by New Jersey Globe.
NJM Insurance Company has been serving New Jersey policyholders for more than 100 years. But just who are NJM's policyholders? They're the men and women who teach our children, the public sector employees who maintain our infrastructure, the workers who craft our manufactured goods, and New Jersey's next generation of leaders, the people who make our state a great place to call home. NJM, we've got New Jersey covered.